Ginger is a member of the plant family Zingiberaceae, which also includes cardamom and turmeric. It is used in numerous forms, including fresh, dried, pickled, preserved, crystallized, candied, and powdered. As much as 115 constituents in fresh and dried ginger varieties have been identified. Gingerols are the major constituents of fresh ginger that are found slightly reduced in dry ginger. By contrast, ginger dehydration products mainly contain shogaols. So in this video, I will discuss about 6 proven health benefits of ginger. Number 1. Ginger has antioxidant properties. The presence of oxidative stress has associated with numerous diseases, as we have already discussed in several of our videos. Oxidative stress occurs because of the formation of free radicals within our body. Antioxidants can neutralize these free radicals. By doing so, they reduce oxidative stress and the risk of disease. More than 50 antioxidants have been isolated from the rhizomes of ginger. The isolated antioxidants are divided into 2 groups: gingerol-related compounds and diaryl heptanoids. Number 2. Ginger has anti-inflammatory properties. Studies have identified ginger as an herbal medicinal product that shares pharmacological properties with non-steroidal anti-inflammatory drugs which are being used to treat inflammation and pain. One of the major chemicals responsible for inflammation is prostaglandin. Research has found that ginger can suppress the synthesis of prostaglandin within cells, which ultimately suppresses inflammation. Therefore, ginger is being used as a supplement in treating chronic inflammatory conditions like osteoarthritis and rheumatoid arthritis. Number 3. Ginger can relieve nausea and morning sickness. The most common and well-established use of ginger throughout history is probably its use in alleviating symptoms of nausea and vomiting. The active agents in ginger, especially gingerols and shogaols, possess the ability to break down and expel the gases accumulated within the stomach and intestines. They also can induce gastric contractions as well as gastric emptying. These activities of gingerols and shogaols are thought to be responsible for relieving nausea and morning sickness. Number 4. Ginger has anti-cancer effects. Cancer is a condition which is characterized by abnormal cell growth. Some of the anti-cancer effects of ginger are partly due to its antioxidant properties. Gingerols, shogaols, and zerumbone are some of these compounds. The effectiveness of ginger in preventing or suppressing cancer growth has been examined in a variety of cancer types, including lymphoma, hepatoma, colorectal cancer, breast cancer, skin cancer, liver cancer, and bladder cancer. Studies also found that the substances mentioned earlier prevent or suppress cancer growth by reducing formation of free radicals, inducing cancer cell death, halting the division of cancer cells, and inhibiting several enzymes that are required for cancer growth. Number 5. Ginger can reduce the risk of cardiovascular diseases. Several studies have found that ginger can lower blood LDL cholesterol and triglyceride levels. In addition, they also found that ginger can increase blood HDL cholesterol levels, which is the good type of cholesterol in our body. High LDL cholesterol and triglyceride levels are associated with an increased risk of cardiovascular disease. So, as ginger has anti-hyperlipidemic effects, it reduces the risk of cardiovascular disease. Research also found that ginger has antiplatelet effects too, meaning that ginger can reduce formation of unwanted blood clots within the bloodstream. However, it is important to keep in mind that if you are already taking anticoagulant medications like aspirin and clopidogrel, avoid taking ginger as it may increase the risk of bleeding. Moreover, research also found that some of the compounds in ginger possess the ability to lower the blood pressure. But if you are already taking medication for lowering blood pressure, avoid taking ginger as it can lower blood pressure significantly. Number 6. Ginger can lower blood sugar levels. Gingerol is the key substances when it comes to the anti-diabetic effects of ginger. Gingerol reduces blood sugar levels by increasing the uptake of glucose by peripheral tissues, reducing glucose production by the liver, and reducing the formation of advanced glycation end products within the bloodstream, which are the major culprits behind the long-term complications of diabetes.